So with no further ado, let's start with a quick 30-second biographical self-introduction of each debater.
Hello. Hi, my name is Mike Plunkett. I am the dental director for Care Oregon, which is one of the state's largest health organizations which cares for Oregon Health Plan patients. I'm also the dental director of Neighborhood Health Center, where I see patients. My patient care is limited to Oregon Health Plan and low-income populations. And I am a professor of community dentistry at Oregon Health Science University.
Good evening. My name is Alejandro Caral. I am a program officer with the Northwest Health Foundation. I am also the co-chair of the Health Kids Healthy Portland campaign. My background is I have a degree in law and a master's degree in biology. I have worked for Multnomah County Health Department, American Heart Association, and the Sierra Club in the past.
Hi, good evening. My name is Kelly Barnes. Thank you for coming out tonight. I'm a physical therapist of 20 years. I have 7 graduate years of study in physical therapy. More importantly, I'm a mom of 2 children. And I first became interested in this issue when my dentist, about a decade ago, asked me to look at the literature because there was statewide legislation pending. He opposed that legislation, and I started reading the literature and discovered that this was not a safe policy for our community. And here I am.
I'm Rick North. I spent over 30 years in health organizations, nonprofit, a little bit in the environment. 21 years with the American Cancer Society. I was the former state director of the American Cancer Society. Before I retired 2 years ago, I worked over 7 years with Oregon Physicians for Social Responsibility. I always say I'm not a physician or a scientist. I just happen to have worked with them for many, many years.
Thank you. Okay, for opening remarks, please start.
Yes. First of all, I want to thank Multnomah County Democrats for hosting this event, and thank members of the audience for coming out, and thank our opponents for coming as well. I can speak for Alejandro and the Healthy Kids, Healthy Portland Coalition in saying that we're very excited to be involved in this process, a process which could lead to a community health measure that could benefit so many members of our community. As a public health dentist, a community health dentist, I see firsthand daily the effects of untreated dental disease, not only on children, but on all members of our family, or all members of our community. I think start off with a story I think that is a good representation of what many of us that do this daily as our careers see. A couple of years ago, I was on a medical team's van, and I saw a young girl, 11 years old, 12 years old. She came in with an abscess, was brought in by the school nurse. As I was working up to remove her tooth, I explained to her that she would be sore, there would be pain for a couple days afterward, and that she'd have trouble eating. She said to me, she started crying, and she said to me, "Doctor, I haven't eaten on that side of my mouth for 2 months, and I haven't been sleeping very well. Please help me." Now, that's not an isolated story. I could do that for an hour. Anyone, any school nurse that sees patients that I see could do that for an hour. In fact, over 1/3 of Oregon's children have untreated dental decay. And dental pain is one of the top reasons people go to hospital emergency departments. I know this because I work with many hospitals in the region that treat their patients. I have programs daily. We do this. Many of us do this. And as a dentist and as a professor of community dentistry, I can tell you confidently that much of this is preventable, and it would be prevented if we fluoridated our water. Other communities have experienced that. But this debate is really not just about fluoride. It's about something much larger. It cuts to a larger question as to whether or not we in Portland are willing to implement solutions to problems that benefit all members of our community and think past our biases, think past our concerns, look at the evidence, face up, and implement solutions that benefit the entire community. Do we respect science? Do we as Portlanders respect the scientific process? Are we willing to look beyond the scope of our own opinions and see what the experience of other communities has been? Now, throughout the rest of the night and throughout this campaign, there's going to be a lot of scary things said. I suspect in the next hour we're going to hear about every single system of the body. Terrifying things. And that's the intent, the sole intent, when we talk about the multiple areas of the body, the systems of the body, is to scare. The tactic, it's a political tactic. The truth is, hundreds of articles, if not thousands of articles, conducted by respected institutions and dedicated scientists over decades have concluded that community water fluoridation is the most safe and effective way to reduce dental disease and the burden of dental disease. It's the most cost-effective way, and it's the best way to alleviate the burden of dental disease for all members of any community that's brave enough to implement community water fluoridation. The science shows this. Every Surgeon General in the last 60 years has endorsed community water fluoridation. The Center for Disease Control, Institute of Medicine, National Academy of Sciences, I could go on, all endorse it. Every single organization that supports children's health care, most respected organizations, if not all, that I'm aware of, that deal with public health, health care, and advocacy in this area, endorse community water fluoridation. The current Surgeon General, we'll talk about that more, Regina Benjamin, has endorsed it, does endorse it, and her office currently endorses it. And all of these organizations endorse it unequivocally as the cornerstone of any comprehensive program to reduce the burden of dental disease in the community. Healthy Kids, Healthy Portland, which we represent, has been endorsed by over 80 local organizations ranging philanthropy, human services, healthcare. And I'm proud of that. And as we move on tonight, you'll hear their names and you'll recognize them. They're full of physicians and advocates that love their community, engage their community every day toward reducing the burden of disease and enhance human wellness. It's time we act, and it's time we act consistent with the Portland value that so many of us hold dear. The value that it's not just about me, it's not just about what I want, but that we should implement solutions that benefit all members of our community. Healthy Kids, Healthy Portland Coalition welcomes you to join us in that fight.
I'm a volunteer for Clean Water Portland. We're the group that gathered over 43,000 signatures in less than a month to bring this to public vote because we believe you should have that choice to vote. I believe in keeping fluoridation chemicals free from our water for 3 reasons. I believe clean water is essential for the health of our community and the health of our kids, and that the recent scientific evidence demonstrates a reasonable basis for concern of this policy. In addition, there are surely better alternatives that are already present, funded by our government and our local communities. Cavities do cause real pain and real suffering. We can and we should do more to prevent them. However, using dramatic anecdotal stories are useful in political campaigns, and they tug at our heart, but they should not be mixed up with the real science or the real numbers. When it comes to Portland's numbers, we are not in a unique dental healthcare crisis, as though you hear or read in the paper. In fact, Portland Metro has an untreated dental decay of 21%. Outside of Portland Metro, 44%. The national oral health objective of our nation is 26%. We've already exceeded that, mostly on non-fluoridated water. When you put this into a national context, we are doing well here, and we should surely be talking about Portland's numbers when we're talking about fluoridating Portland's water. Recently, many organizations have joined our campaign endorsing the Sierra Club, Food and Water Watch, local acupuncturists, and organ chiropractic associations.